You are listening to the Pregnancy Podcast with Vanessa Merton.
Hello. Thank you for tuning into the Pregnancy Podcast. In today's episode, we're talking about how to prevent and relieve back pain during pregnancy. So many of the physical changes that come with pregnancy can put stress on your back, and that can lead to pain and discomfort. Back pain during pregnancy is almost always lower back pain, and it falls into one of three categories: lumbar spine pain, posterior pelvic pain, or a combination of the two. This is incredibly common, and the likelihood only goes up as your pregnancy progresses. But just because it's common doesn't mean that you have to suffer through it. In this episode, I will break down why back pain happens during pregnancy, how you can prevent it, and the evidence-based tools and treatments that can bring you relief. We'll go through everything from simple daily habits to hands-on therapies and medication considerations. You can find the full article and all of the resources for this episode at pregnancypodcast.com/backpain. Back pain is one of those things that most pregnant women deal with, but you shouldn't have to just suffer through it. I make this show to give you real answers, and Pregnancy Podcast Premium is one of those ways that I can keep it going. When you join Pregnancy Podcast Premium, you get every episode of the podcast with hundreds of evidence-based episodes that you won't find anywhere else. Plus, it's all ad-free, including new episodes each week. Check it out at pregnancypodcast.com/premium. Zoller goes above and beyond in formulating their Prenatal Plus DHA. It's made with high-quality ingredients like the active form of folate, bioavailable iron, and essential nutrients like omega-3s. In the month of July 2026, save 40% on Amazon with the code ZPRENATAL40. And you can always find the current promo code for the Zoller Prenatal at pregnancypodcast.com/vitamin. The VTech RM6756 baby monitor has color night vision, a 5.5-inch HD screen, and ultra-wide 135-degree viewing, plus free remote access and never subscription fees. VTech is the #1 baby monitor brand in North America and trusted by millions of families. The VTech RM6756 is available at Target. Check it out at pregnancypodcast.com/VTech. From skincare to treating common pregnancy symptoms like stretch marks with clinically proven ingredients, 8 Sheep Organics has you covered. Every product comes with a 100-day happiness guarantee. If you are not 100% happy with your purchase, simply send them an email and they'll get you a refund, no questions asked. Check out 8 Sheep Organics and save 10% when you visit pregnancypodcast.com/8sheep. Back pain can affect nearly every part of your life: your quality of life, your work, sleep, your relationships. And the prevalence of back pain in pregnant women is estimated at around 50% in the first trimester. In the second trimester, it ranges between 40 and 70%. And by the third trimester, that number climbs to 70 to 80%. So you can see from this data that most pregnant women will deal with back pain at some point. Taking care of your back matters even more if you have a history of back pain. A prior history makes it more likely that you will experience it during pregnancy. There's also evidence that having back pain in one pregnancy makes it more likely that you will have it in future pregnancies. Not all pregnancy back pain is the same, and knowing which type you have can help you find relief faster. Lumbar pain is what most people picture as back pain. It shows up in your lower back, around the curve of your spine, and it often feels worse after sitting or standing for long stretches. Posterior pelvic pain is different. This pain is lower down in the back of your pelvis and can radiate into your buttocks or the backs of your thighs. It often flares with everyday movements like climbing stairs, rolling over in bed, getting in and out of a car. This type of pain falls under the umbrella term pelvic girdle pain. In some cases, the ligaments that are connecting the two halves of your pubic bone loosen excessively, and this can lead to a painful and destabilizing condition called symphysis pubis dysfunction. If your pain is low in the pelvis rather than in your lower back, or if it feels like your pelvis is just unstable, please talk to your doctor or midwife because management may look different. For simplicity in this episode, we're going to group all of these under the term back pain. And much of the advice that follows applies whether your pain is lumbar, pelvic, or a mix of both. Many expecting moms hear the word sciatica and assume that that's what they have. Sciatica refers to pain that follows the path of the sciatic nerve. That runs from your lower back through the back of your leg. True sciatica involves that nerve being irritated or compressed, and then pain tends to shoot down one leg, sometimes with tingling or numbness. What feels like sciatica in pregnancy is frequently not sciatica at all. In fact, one review notes that true sciatica shows up in only about 1% of pregnant women, and that pelvic girdle pain is roughly 4 times as common as lumbar pain. So more often than not, what feels like sciatica is actually pelvic girdle pain or just muscle tension that's referring pain into a similar area. Back pain, while we're talking about this during pregnancy, it doesn't necessarily stop when you go into labor, and it can linger after you have your baby too. Ideally, you're heading into labor feeling good. You're not having any back pain that could limit things like the positions that you could be in. But after you have your baby, back pain can become a problem because you're constantly carrying a newborn. You're looking for comfortable positions. You're sitting in positions for long periods while you're breastfeeding. One study found that 20% of women who experienced low back pain during pregnancy were still symptomatic 3 years later. So this is a very strong reason to take your back pain seriously now. This is not just one of those symptoms that you can assume will just disappear on its own after you have your baby. When I say that back pain can really affect all areas of your life, I mean it. And this is backed by research. Research has identified back pain as one of the many pregnancy-related factors that influences your quality of life. That describes how healthy, comfortable, and able to enjoy life you are. Researchers measure this with questionnaires. They look at areas like physical functioning, bodily pain, general health, vitality, social functioning, mental health. One study examined the relationship between low back pain and quality of life in pregnant women, and it found significant differences in mental health, physical health, and social relationships between women with back pain and a control group. Another study found that lower back pain and pelvic pain negatively affected perceived health and sexual life, and that women with back pain also reported more sick leave from work. There's even evidence that back pain increases your risk of anxiety and depression. The point in sharing all of this research is that relief is worth pursuing. I do not recommend that you just try to power through this. So to give you a full understanding, let's talk about what causes back pain. You go through a lot of physical changes during pregnancy, and a lot of these put additional stress on your back. So understanding what these causes are can help explain why certain prevention strategies and treatments that we'll talk about later actually work. First is weight gain. A higher body weight is a predictor of back pain. One study that followed women from mid-20s to mid-30s found that for every 5 kilograms, or about 11 pounds, of higher weight at baseline, there was a 5% increase in the risk of back pain over the following 12 years. Weight gain during pregnancy is both normal and necessary, and there's a full episode that's dedicated to this topic. Even with the guidelines, so as an example, if you start out at a normal weight, that would be based on your BMI prior to pregnancy, it's recommended that you gain between 25 to 35 pounds during your pregnancy. And those guidelines change if you start out underweight or overweight. Even with the guidelines, most women are not gaining within these ranges. One study that looked at over 18,000 pregnancies found that just about 25% gained within the recommended range, 21% gained less, and nearly 53% gained more. So the higher your weight is, the more pressure and stress is on your spine and your joints. And as a result, keeping your weight within a healthy range before, during, and after pregnancy can lower your risk of back pain. Most of the weight that you gain during pregnancy sits in your belly. And as your pregnancy progresses, that growing belly will shift your center of gravity forward. To compensate for that, you may lean back, and that strains the muscles in your lower back. This is a subtle shift in how you hold yourself, but it can also be a big contributor to pain. Weight gain and a shifting center of gravity both change your posture during pregnancy. If you have poor posture, that puts extra strain on your spine. So good posture, picture sitting or standing tall with your back straight, your chest high, and your shoulders back and relaxed. If you are sitting, you should choose a chair with good back support. You can consider adding additional support to your lower back, especially if you're spending a lot of time at a desk. You could get a specific lumbar support pillow. Before you go out and buy anything, I would try a small pillow that you have around your house. That may do the job just as well for free. Good posture also matters a lot after you have your baby. And that's because as a new mom, you're going to spend a lot of time sitting and feeding your baby. So take an extra minute to adjust your position, add a pillow, prop your feet up, get comfortable. Also, nursing pillows can be a huge help because they can help support your baby's weight while you're feeding them. Another thing that pregnancy creates is more relaxin and looser ligaments. Your ligaments are the connective tissues that hold your bones, joints, and organs in place. And during pregnancy, you have a hormone called relaxin that causes those ligaments to loosen. There is an upside to this, and that's that it helps your body open up for labor and birth. But the downside is that it doesn't just limit its effects to your pelvis and your hips right before you go into labor. This affects your entire body throughout your pregnancy. So when the ligaments that support your spine are loose, your joints become less stable. So as a result, they're more prone to overstretching, and that can lead to pain or injury. The looser ligament effect will come up again. We will talk about lifting and exercise because it really changes how much strain your body can safely handle. Now you can see there are lots of pregnancy changes that can contribute to back pain, but there's also a lot of everyday habits that can help you prevent it or ease it if you're experiencing it. These are really the foundational strategies worth building into your routine. So think of these as the first line of defense. First up is sleep. There is mounting evidence about how important sleep is for every aspect of your physical and mental health. Back pain, unfortunately, can disrupt both your sleep duration and the quality of your sleep. One study found that nearly half of pregnant women reported that lying down in sleeping positions were associated with their back pain. Another study reported that 43% of women with low back pain experienced sleep disturbances, and most reported that pain woke them up at night. The takeaway from this is that getting comfortable for sleep can make a difference. The American College of Obstetricians and Gynecologists recommends sleeping on your side later in pregnancy with one or both knees bent. It may also help to place a pillow between your knees and another under your belly. Or try a full-length body pillow that can make side sleeping much more comfortable. Next is exercise. A sedentary lifestyle raises your risk of back pain. Studies have found that people who move less are more likely to experience back pain than those that stay active. Exercise helps by building strength and improving flexibility. One study found that women who had not engaged in physical activity were more likely to experience lower back pain. That said, exercise may not fix pain that's already here. A Cochrane review found low-quality evidence that exercise may reduce pregnancy-related low back pain, along with moderate to low-quality evidence that it improves functional disability and reduces sick leave more than usual prenatal care. So the evidence really isn't airtight on this. If you are currently in pain, you may need to tone down your workouts or take it easy until you're recovered. And you can modify nearly any exercise to be safe during pregnancy. When your back is feeling good, though, staying active is one of the best long-term strategies to strengthen your body and prevent pain from returning. One thing you may want to consider is aquatic exercise. Water is a great place for a workout. When you're in a pool, you have buoyancy to support your body weight, take some pressure off your spine and your joints. You can move and strengthen your muscles without the impact that you'd feel working out on land. For all of these reasons, aquatic exercise is one of the more back-friendly ways that you can stay active during your pregnancy. The evidence here is pretty encouraging. One randomized controlled trial followed 516 healthy pregnant women. Half were assigned to an unsupervised water exercise program twice a week for 12 weeks. The other half received standard prenatal care. The women who exercised in the water reported significantly lower back pain intensity than those who did not. And a key thing here is this program was unsupervised. So you don't need to go enroll in a class at a gym that has a pool and get an instructor to teach you how to do this. This is something that you could completely do on your own. And you don't have to swim laps to get these benefits. Gentle water walking, prenatal aqua aerobics, if you want to try that, could be good. Just simple movements can all help. So if you have access to a pool, please take advantage of it. Beyond general exercise, there's a few gentle movements that can specifically target back pain, and you can do all of these at home with no equipment. A good place to start is with pelvic tilts. So you're going to get on your hands and knees with a flat back, and then gently tighten your abdominal muscles and tuck your pelvis so that your lower back rounds slightly. You're going to hold that for a few seconds and then release. That's a simple movement that can help relieve tension in your lower back. Another good technique is the cat-cow stretch. So from that same hands and knees position, you're going to slowly alternate between arching your back up towards the ceiling and then letting it gently sag while you lift your head. You want to move with your breath here. You can also try child's pose. This is where you sit backwards towards your heels with your knees wide to make room for your belly. This will get more difficult as your belly gets bigger, but then leaning forward into that child's pose can really feel good if your lower back is feeling tight. A lot of these movements come directly from prenatal yoga. That's one of the safest and most back-friendly forms of exercise during pregnancy. If you're going to try any of these, move slowly. Avoid pushing into any pose that hurts. And if at any point something does not feel good for your body, stop doing it. With this talk of exercise and back pain, we have to cover lifting. Because relaxin leaves your ligaments looser, your joints are less stable. And that means that it's easier to overstretch, which can cause pain or injury. ACOG specifically notes that lifting poses a risk of musculoskeletal injury and low back pain during pregnancy. You should be cautious lifting anything, and you should use proper form to prevent injury. So you don't want to bend over at your waist. You want to bend at your knees and keep your back straight. So if you're lifting something, think of it more as a squat rather than leaning over an object. And then when you do lift something, you want to avoid any sudden movements that jerk your body. If your job involves lifting, the National Institute of Occupational Safety and Health recommends specific lifting limits for the workplace, and they have guidance for pregnant workers. These limits vary based on where you are in your pregnancy, the height of the lift, how far the item is from your body, and how often you're lifting. This is useful if you work in a job in which you have to lift things throughout the day, but none of these guidelines extrapolate well to lifting weights or strength training during pregnancy. I said it before and I'll say it again. Every exercise can be modified to be safe during pregnancy. And there is a full episode on strength training that does a deep dive into the research on that topic. It's not just heavy lifting that triggers back pain. One study identified 16 kinds of motion that participants felt induced pain. The 3 that were most associated with lower back pain were sitting up, standing up from a chair, and tossing and turning while lying down. These are simple, basic things that we all do every day. And they're more strongly linked to pain than special motions that require extra effort. The reason is that these all involve rotating and bending your trunk. So anytime you're going from lying to sitting or from sitting to standing, be mindful about how you move. I mentioned lifting in the workplace. ACOG acknowledges that physically demanding work is associated with low back pain and musculoskeletal disorders in the general population. And this includes heavy lifting, excessive repetition, awkward postures, and long periods of sitting or standing. For a lot of people, that describes your job. One study found that nearly 39% of pregnant women identified sitting as one of the most significant factors causing their lower back pain. Spending most of your day sitting or at a desk can be really tough on your back. So you want to sit in a comfortable chair with proper support. That's really important. On the other side of that, if your job requires standing for really long periods, you may want to take breaks to sit, stretch, or move around. If there's any work-related activities that you're concerned about or you have questions about, please bring those up with your doctor or midwife. They can give you more information and resources that can help you understand your employment rights. They may be able to provide some documentation to your employer if you need to request an accommodation. If back pain does start affecting your ability to work, that could require taking sick days, taking time off. Many moms try to avoid taking any time off during their pregnancy because they're trying to save up as many hours as possible for maternity leave. And I get it. I've been there and I've done the exact same thing. But if you are in pain, you have to give yourself time to heal. And you have to take a break from those positions or those movements that are aggravating your back. Otherwise, you risk the pain getting worse. Now that we've covered why back pain happens, a lot of the everyday lifestyle things that you can do to prevent it and treat it, let's really get into the tools and treatments for back pain. Before we do that, I would like to thank the sponsors that have supported this episode. A lot of companies have exclusive discounts just for pregnancy podcast listeners. You can always see discounts and promo codes at pregnancypodcast.com/resources. It can be really challenging to meet your increased nutrient requirements during pregnancy just with your diet alone. And taking a high-quality prenatal vitamin is the easiest way to ensure that you and your baby have all of the vitamins and nutrients that you need. My top recommendation is the Zoller Prenatal Plus DHA. And that is because it's high quality and they use bioavailable ingredients. Plus, they formulate their vitamin on the latest scientific evidence. They're not building it off of outdated RDAs that can lag years behind the research. Every serving includes 300 milligrams of DHA. This is a critical nutrient for your baby's brain and eye development. It also supports your mood, cognitive function. It's even important for your mood postpartum. And the majority of prenatal vitamins do not have DHA. This is just one detail on a very long list as to why this is my favorite prenatal vitamin. In the month of July 2026, save 40% off the Zoller Prenatal Plus DHA on Amazon with the code ZPrenatal40. And you can always see the current promo code at pregnancypodcast.com/vitamin. If you want to see your baby from another room, from the backyard, or from somewhere away from home if you're not there, a monitor with smartphone access is really useful. The tricky part is finding one that does not lock that feature behind a monthly subscription. The VTech RM6756 baby monitor solves this problem. You get free live remote access through your smartphone or tablet with no subscription fees ever. At home, you can watch on a 5.5-inch high-definition color LCD screen with 1080 pixel video quality and ultra-wide 135-degree viewing so that you can see more of the room at a glance. Color night vision gives you a much clearer picture in low light than traditional black and white night vision, and the touch adaptive multicolor nightlight automatically adjusts brightness to match the nursery. You also get a 2-way talk back intercom, lullabies, and ambient sounds including white noise, plus a temperature sensor and up to 1,000 feet of range. VTech is the #1 baby monitor brand in North America, and it's trusted by millions of families. The VTech RM6756 is available at Target. Check it out at pregnancypodcast.com/VTech. Let's get back to today's episode. Beyond everyday habits, you may want to try various tools and treatments to prevent or to relieve back pain. A lot of these are inexpensive and come with minimal downsides, so most of them are worth a shot. First is hot or cold compresses. This is a simple intervention. This is one of the things that's recommended by ACOG. You may need to experiment with both to find out what gives you more relief. Cold constricts blood vessels, it decreases inflammation, and can numb pain. So that tends to work earlier on if you hurt your back. Heat, on the other hand, increases blood circulation, which can help with healing. ACOG does caution that pregnant women should use heating pads at the lowest possible temperature setting, and ACOG recommends limiting how long you use heat or cold at one time. One thing you may want to try is a maternity support belt. This can take some of the strain off your spine and your muscles by supporting the weight of your growing belly. If you're dealing with lower back pain, a support belt may relieve some of that pressure. And many women also find that it's easier to maintain good posture while you're wearing a support belt. The evidence here is promising but not definitive. A Cochrane review examined support belts among other interventions for pregnancy-related low back pain and pelvic pain. Some of the individuals found that a support belt helped, though the overall quality of the evidence was low. Support belts are relatively inexpensive, they're low risk, they're very easy to try. Even though we don't have strong proof that they work for everyone, this may be worth a shot if you want some extra support. Another recommendation directly from ACOG is wearing supportive shoes to prevent or ease back pain during pregnancy. Specifically, they suggest low-heeled shoes, though not flat ones. You want shoes with good arch support, like walking or athletic shoes. You should avoid high heels because those tilt your body forward and strain your lower back muscles. One way to make sure that your shoes have good arch support is to use insoles. Insoles slide right into whatever shoes, flats, boots, athletic shoes, and instantly make them more comfortable. Good arch support will help support your posture. And I've done a lot of research on this topic. Wearing insoles can help with lower back pain, and it can also help prevent a lot of foot issues that can come up during pregnancy. Another thing you may want to try to ease back pain is prenatal massage. Ideally, if you're going to get a massage during your pregnancy, this is done by a trained and experienced therapist that specializes in prenatal massage and understands how pregnancy changes your body. With that being said, massage doesn't mean that you have to go to an expensive spa. Even a massage from your partner may help relax your muscles and relieve some of your pain. Another thing that you may want to consider earlier rather than as a last resort is physical therapy. A physical therapist can assess your specific situation so they can give you targeted exercises, stretches, and hands-on techniques to relieve pain, improve stability. This could be especially relevant if your pain is persistent or if it's stemming from pelvic girdle pain. Physical therapy sounds very promising. The evidence on this really isn't definitive. A systematic review of physical therapy for pregnancy-related back and pelvic pain found no strong evidence for or against it. And largely that's because the available studies were small and of mixed quality. In other words, physical therapy may help, but the research hasn't firmly proven it. That being said, it's a low-risk approach. Many women find it valuable, particularly when a therapist can tailor a program to their specific pain. There's also physical therapists that specialize in the pelvic floor. And that matters because your core and your pelvic floor work together to support your spine. If back pain is not responding to other basic things, you may want to ask your doctor or midwife for a referral. And as with any practitioner, you want to look for somebody that has experience treating pregnant patients. Another technique that's often used for pain relief is acupuncture. This is a key component of traditional Chinese medicine. The idea, practitioners of this believe that qi flows throughout pathways in your body called meridians, and that by inserting extremely thin needles into specific points along these meridians, that they can rebalance your energy flow. Many Western practitioners instead view these points as places to stimulate nerves, muscles, and connective tissue, which may boost your body's natural painkillers and increase blood flow. Overall, the side effects of acupuncture are minimal. The most commonly reported side effect is just mild pain from getting stuck with needles. For many people, that's not a thing at all. There is evidence that this is a safe practice during pregnancy. Of course, there is cost associated with it if you're going to visit an acupuncturist. If this is something that you would like to try, of course, make sure that you go to a reputable place and seek out a licensed acupuncturist with experience treating pregnant women. Another professional that you may consider is a chiropractor. Chiropractors typically use their hands or an instrument to manipulate the joints of the body, especially the spine, and they do this to restore or enhance joint function. This can help to resolve joint inflammation and reduce pain. One study found that most pregnant patients undergoing chiropractic treatment reported clinically relevant improvements. And again, you want to seek out a chiropractor that specializes in or that has experience with pregnant patients. Somebody that works with pregnant clients regularly will understand how pregnancy shifts your posture and your joints, and they'll have the right equipment and tools to help accommodate your growing belly and keep you comfortable and safe. You may also consider a TENS machine. This is a small handheld device that has wires attached to electrode pads that you stick on your skin. TENS stands for transcutaneous electrical nerve stimulation, and people with chronic pain commonly use it. One study compared TENS to exercise and acetaminophen. The researchers found that TENS improved lower back pain more effectively than either, and they concluded that it was effective and safe for lower back pain during pregnancy. This was just a single study, so evidence here is limited, but TENS is low risk and may be worth exploring. TENS is also something you could potentially use during labor to help manage the discomfort of contractions. And of course, there's a whole episode on that. Now let's talk about medications. A lot of people get temporary relief from back pain with topical treatments or pain medications. But when you're pregnant, you have extra considerations. Before taking any over-the-counter or prescription medicine, you want to discuss it with your doctor or midwife. If you're breastfeeding, there's a database called LactMed that's a fantastic resource to check the safety of medications while breastfeeding. Unfortunately, we don't have a resource like that during pregnancy, so it's a little bit more difficult. When we're talking about over-the-counter medications, the main ones are aspirin, non-steroidal anti-inflammatory drugs, NSAIDs. Those include ibuprofen and acetaminophen. Each of these comes with different considerations during pregnancy. Aspirin is usually not recommended during pregnancy or breastfeeding for pain relief. There's exceptions for low-dose aspirin to prevent preeclampsia. That's a completely different use. Ibuprofen is also usually not recommended. The FDA recommends that pregnant mothers avoid ibuprofen after 20 weeks because it can lead to low amniotic fluid. There's also evidence that ibuprofen and other NSAIDs can increase your risk of miscarriage early in pregnancy. Because of the risks that are associated with aspirin and ibuprofen, medical professionals have long preferred acetaminophen during pregnancy. You may also know this by the brand name Tylenol, or in Europe, paracetamol. Acetaminophen has long been considered the safest choice for managing pain and fever during pregnancy. But there has been a lot of controversy in the last year that has understandably left a lot of expecting parents with questions. The very short version of this is that some research has raised concerns. There was a study that linked maternal acetaminophen use during pregnancy to an increased risk of asthma in children. Another study found an association between acetaminophen use and behavioral problems in kids. In 2021, 91 scientists and clinicians released a consensus statement cautioning against acetaminophen use in pregnancy, arguing that it might alter fetal development. Days after that happened, ACOG responded that the evidence showed no clear proof of a direct relationship between prudent acetaminophen use and fetal development issues and advised no change in clinical practice. Then fast forward to 2025, the FDA issued a notice to physicians saying that evidence has accumulated suggesting a possible association between acetaminophen use during pregnancy and neurological conditions like autism and ADHD. This notice was clear that there's not a causal relationship that's been established, and there are contrary studies, and acetaminophen still remains the safest over-the-counter option for pain and fever during pregnancy. Because remember, aspirin and ibuprofen carry well-documented risks. In response to this, ACOG came back and affirmed the safety and benefits of acetaminophen during pregnancy. They pointed out that in more than 2 decades of research, no reputable study has concluded that acetaminophen used in any trimester causes neurodevelopmental disorders. It highlighted that the 2 highest quality studies on the subject, including a large study that was published in 2024 that analyzed nearly 2.5 million children, found no meaningful link between acetaminophen use in pregnancy and autism, ADHD, or intellectual disability. That particular study is especially compelling because it compared siblings, so it helped rule out genetic and family factors that some of the earlier studies could not. I know that's probably a little too much detail. What does all of this mean? There's genuine disagreement between some governmental health agencies and physician organizations, and even where your own doctor or midwife lands, maybe somewhere in the middle. The practical guidance really hasn't changed, and that is that you should use the lowest effective dose for the shortest time that you need it. Fevers are a special case because acetaminophen is an antipyretic and that it will reduce a fever. For the purposes of this episode, we're going to stay focused on using acetaminophen for pain relief. Fevers are really a completely different conversation with a lot more nuance. Another thing to keep in mind here is autism is a spectrum disorder, and it has many genetic and environmental contributors. And the research to date shows correlation, but not causation. If you want to go deeper down this rabbit hole, there are dedicated episodes on the safety of Tylenol during pregnancy, another follow-up with a bunch of listener questions on that topic. Big takeaway here is you want to discuss any medication with your doctor or midwife, and then weigh the severity and the frequency of your back pain against the benefits and risks. As an example, if you are mildly uncomfortable from back pain, it may not be worth it to take the potential risk of taking acetaminophen if you can kind of just get through it without it. If your back pain is severe, that's a different equation, and you'll have to talk to your doctor or midwife to weigh those risks and benefits. Just to touch on prescription medications, opioids are the last line of defense for back pain. ACOG states that for chronic back pain, the goal is to avoid or minimize opioid use. Instead, it highlights alternative therapies, including non-pharmacologic approaches like exercise, physical therapy, and behavioral strategies, as well as non-opioid medications. Most of the tools and techniques that we've talked about in this episode really fall into that safer first line of defense category. Another thing that I want to touch on if we're talking about medications is topical treatments. This would be creams, gels, patches, rubs, things that you apply directly to your skin. These are appealing during pregnancy because they act mostly where you put them. So theoretically, you'd have less of the drug reaching the rest of your body than if you were taking a pill. But less absorption doesn't mean zero absorption. And some of these products carry some of the same cautions as the oral versions. As we cover these, it's worth noting that there are essentially no studies testing these specifically for pregnancy back pain. So most of what we know is coming from drug safety data rather than trials on effectiveness. So you have topical NSAID gels. These are a popular option for muscle and joint pain outside of pregnancy, but they come with the same concerns during pregnancy as oral NSAIDs. When applied to the skin, the main ingredient in this crosses the placenta. The FDA label carries the same pregnancy warnings as the oral form. I did find there was one documented case where a topical NSAID combined with another kind of topical treatment caused a temporary narrowing of a vessel in a baby's heart that did reverse once the mother stopped using it. Because of this, NSAID gels are generally not recommended during pregnancy, and they should be avoided entirely after about 30 weeks. Next, you have menthol and salicylate rubs. These are warming or cooling. So think Bengay, Icy Hot, Tiger Balm, Salon Paws. These work as counter irritants. So what they do is they create a hot or cold sensation that distracts from the pain underneath. The catch, though, is what's in them. Many of these contain methyl salicylate. This is closely related to aspirin, and it does absorb through the skin. Plus, heat and physical activity increase how much of it you absorb. For that reason, product labels advise against using this at 20 weeks or later in pregnancy unless directed by a doctor, and then, like other NSAIDs, to avoid using it after 30 weeks. Menthol on its own is considered a safer counter irritant, so a menthol only product is generally a better choice than one containing salicylates. Either way, check the ingredient list, use it sparingly, avoid applying it over a really large area or under anything that traps heat, and of course, run anything by your doctor or midwife before you use it. You also have lidocaine patches and creams. Lidocaine is a numbing medication that's found in over-the-counter patches and creams. This tends to be one of the more reassuring topical options during pregnancy. This was previously classified by the FDA as Category B. The FDA doesn't use these same categories anymore. That essentially meant that animal studies did not show harm to the fetus. Systematic absorption from the patch is low. And I will include a mother-to-baby fact sheet, I'll link to that reviews its use in pregnancy. A lidocaine patch can be applied to a sore spot for up to about 12 hours. You can cut it to fit so that you're not using a bigger patch than you need to. Again, as with anything, you want to use it as directed, and of course, check with your doctor or midwife first. But this is often the go-to when NSAIDs are off the table. The last one I want to touch on is arnica. This is a plant-based remedy that's sold as a topical gel or cream. It's essentially a homeopathic product. It's often marketed for bruising, muscle aches, and soreness. Some sources consider diluted topical arnica low risk in pregnancy, but others recommend avoiding it altogether because of the lack of safety data. We know that oral botanical arnica should be avoided. That contains toxic components. It should not be taken during pregnancy. Arnica can also increase bleeding and interact with blood thinners, so it shouldn't be applied to broken skin. The evidence as to whether or not this actually works is pretty inconsistent, and none of the research examines pregnancy-related back pain specifically. So arnica, again, like everything, run it by your doctor or midwife. I know we've covered a lot in today's episode. Bottom line here, back pain during pregnancy is incredibly common, but it doesn't mean that you have to just grit your teeth and endure it. Once you understand what's driving your pain, whether it's your shifting center of gravity, looser ligaments, daily habits, your job, you can take steps to prevent and relieve it. Start with the foundational habits. Remember the first line of defense. Having good posture, sleeping in a supportive position, gentle movement, safe lifting. From there, you have a whole toolbox of low-risk options using heat and cold, massage, physical therapy, acupuncture, chiropractic care. The main takeaway is I don't want you to wait until the pain becomes unbearable. Taking care of your back proactively is far better than trying to recover once you were in significant pain. Of course, this is something that you should talk to your doctor or midwife about. If you're experiencing any pain or feeling any instability in your back, please bring it up with your doctor or midwife and be specific about where it hurts, when it flares up, what makes it better or worse. Those details can help them figure out whether you're dealing with lumbar pain or pelvic girdle pain or something that needs a closer look. And your doctor or midwife can also help connect you with other resources like a referral to a physical therapist. They can give you guidance on safe medications if you're considering going that route, or help you document something if you need an accommodation at work. One red flag warning you should know about: if your back pain is severe, if you have a quick onset of back pain, it could be a sign of preterm labor. If back pain is accompanied by a fever, you also want to contact your doctor or midwife. That could be a sign of infection. In regards to just normal, typical back pain, ACOG says that you should contact your doctor if the pain lasts more than 2 weeks. 2 weeks is a really long time to be uncomfortable, especially with a pain that can really affect every part of your life. You should feel comfortable reaching out to your doctor or midwife at any point if you have any concern. So if you're dealing with back pain that's uncomfortable, please don't feel like you have to wait 2 weeks or wait until your next prenatal appointment. You can always reach out to your doctor or midwife. To recap everything that we talked about in today's episode, we started with how common back pain is during pregnancy, how it can affect everything, your quality of life, your sleep, your work, even your mental health. We talked about the difference between lumbar pain and pelvic girdle pain. I covered all of the different causes of back pain during pregnancy. And then we went through a lot of things that will help, from everyday habits, your sleep positions, getting exercise, gentle stretches like pelvic tilts and cat-cow. And then we went through a whole toolbox of treatments that you can try. Things like heat and cold, support belts, supportive footwear, massage, physical therapy, acupuncture, chiropractic care, TENS machines, and then took a very close look at different medications, over-the-counter prescription, oral things, and medications that can be applied topically. If you are dealing with back pain or you're just looking to prevent it, I hope that this episode is helpful for you. I would like to thank you for tuning into the Pregnancy Podcast today. If you have a friend that's pregnant, please share the podcast. So many listeners find it through recommendations, and I appreciate you sharing it. As always, you can contact me, Vanessa, at pregnancypodcast.com. You can read the full article and see all of the resources that accompany this episode at pregnancypodcast.com/backpain. If you're looking for more evidence-based information, Pregnancy Podcast Premium gives you ad-free access to hundreds of episodes with evidence-based information that you won't find anywhere else. Check it out at pregnancypodcast.com/premium.